You know, breastfeeding pain is one of the most common and, let's be real, most stressful challenges for new parents. But what if I told you that it's not a requirement, that it doesn't have to be that way? In this explainer, we're going to walk through a super clear 4-step action plan straight from doctors to help you get that pain-free latch. And this right here, this is our starting point. That whole idea that you just have to grit your teeth and bear it is completely outdated. The bottom line is pain during breastfeeding is almost always a mechanical issue, which means it has a mechanical solution. It's not some test of your motherly strength. And I really want to be crystal clear about this. Yeah, breastfeeding is natural, but getting a good latch, that's a learned skill. It's like a synchronized dance between you and your baby, and you're both learning the steps for the very first time. So this isn't about failure, it's about figuring it out together. Okay, so how do we fix this? Well, first we gotta understand why it's happening in the first place. And the source material gives us this brilliant analogy that makes it all make sense. So I want you to imagine your breast is like a super thick milkshake. Now the nipple, that's not where the milk is. It's just the straw. The actual milkshake is waiting in the pouch right behind it, which is the areola. So if your baby only latches onto the straw, well, they're working really hard and getting absolutely nothing. And this is where it all clicks into place. A shallow latch, where they're just on the nipple, is just sucking that empty straw. It causes friction, damage, and yeah, a lot of pain for you. A deep latch, where they get a big mouthful of the areola, the pouch, that's a whole different story. It's totally pain-free for you, and it's a full meal for them. All right, so we get the problem. Now for the good part, the solution. We are moving way beyond vague advice like, oh, just hold the baby closer. No. These are 4 objective, measurable steps you can literally follow every single time to get that perfect, deep latch. We're going to break down each one, but just so you know where we're headed, it all starts with posture, then we wait for that perfect moment, we aim for a very specific target, and we have a built-in safety rule to protect you. Okay, step 1, and this is so important. Alignment is everything. Before you even think about bringing the baby to your breast, make sure their tummy is touching your tummy, their little ear, shoulder, and hip should all be in one nice straight line. Just think about it. Try to chug a big glass of water with your head cranked over your shoulder. It's impossible, right? It's the exact same thing for your baby. All right, step 2 is all about patience. You're never, ever gonna force your breast into a semi-closed mouth. Instead, you just gently tickle your baby's upper lip with your nipple. That'll trigger their rooting reflex, and then you wait. You're waiting for that huge, wide-open, exaggerated yawn. We're talking at least 140 degrees. Only at that exact moment when their mouth is at its widest do you bring them in swiftly to the breast. Okay, this might surprise you, but a perfect latch isn't actually centered like a bullseye. It's supposed to be asymmetrical. You want to aim your nipple up towards the roof of your baby's mouth. When you do this, it makes sure their chin is buried deep into the breast and their nose is free to breathe. So here's your visual check. You should see more of your areola above their top lip than below it. And step 4. This is your non-negotiable safety rule, your get-out-of-jail-free card. Now, a strong tug or a stretch for the first 30 seconds or so, that can be pretty normal. But if you feel a sharp, biting, pinching pain that lasts longer than that, the latch is wrong. And please, whatever you do, don't just pull the baby off. Ouch, that can really cause some damage. Instead, just slide your clean pinky finger into the corner of their mouth to gently break the suction. Then you can reset and try again. Okay, so you've followed the steps, the pain is gone, but how do you really know it's working? Like, is the baby actually getting enough milk? Well, there are a few key signs to look for and listen for. This is where you've got to become a detective and use your ears. So when a feed starts, you'll hear these quick, fluttery sucks. That's just the baby telling your body, hey, release the milk. But once that milk starts flowing, the whole pattern changes. You want to see these deep, rhythmic jaw drops, and most importantly, you want to hear that distinct ka sound of them actually swallowing for every 1 or 2 sucks. That's your proof they're drinking. So something you might not know is that while you're in the hospital, the nurses and doctors are often evaluating your feeds using a scoring system. And listen, this isn't a test to grade you, okay? Think of it more as a communication tool. It helps them know exactly what kind of support you need. It's called the Latch score, which is just a handy acronym for the 5 things they're looking at. They're checking out the latch itself, listening for that audible swallowing, looking at the type of your nipple after the feed, checking on your comfort level, and making sure the hold is working for both of you. Each one gets a quick score from 0 to 2. So yeah, a score of 8 to 10, awesome. But if your score is lower, and I really need you to hear this, it is not a failure. It's just a signal. It tells your medical team that they need to jump in with some more hands-on support to get you on the right track before you go home. It's incredibly common, especially if you've had a C-section. All right, let's switch gears and do some rapid-fire myth-busting. This is all about separating what's actually a medical fact from all the other noise out there. Okay, let's just get this one out of the way because it's the biggest and most damaging myth out there. Enduring severe pain does not make you a better mother. In fact, it actively works against your milk supply. Pain floods your body with stress hormones, and those hormones literally put a stop sign up for oxytocin. That's the key hormone that pushes the milk out. So a pain-free mom is a mom who can make more milk. Simple as that. Here's another one that causes so much anxiety, this idea of having weak milk. The source is so clear on this. Human milk quality is almost always fantastic. If your baby is feeding for an hour straight and is still screaming and hungry, it's almost never about your milk. It's about a shallow latch. It's a plumbing problem, not a product problem. Oh man, this next one is so important. Please, please, please stop aggressively washing your nipples with soak. Your body is amazing. It makes its own natural antibacterial oils that protect your skin. And not only that, those oils have a scent that's similar to amniotic fluid. It's like a built-in GPS that literally guides your baby to the breast. A normal daily bath is all the cleaning you need. And finally, let's talk red flags. These are the signs that mean you stop what you're doing and call your doctor or lactation consultant right away. No waiting. If your nipple comes out looking pinched, like the tip of a new lipstick, if you hear a constant clicking sound when the baby feeds, if you're getting fewer than 6 wet diapers in a 24-hour period after day 5, or if you get a fever with a red, hard spot on your breast, all of these need medical attention. Okay, as we start to wrap this up, I want to leave you with a final, really reassuring note, taken straight from the source. So, if you're in the thick of it right now, and this whole dance feels chaotic and clumsy, just remember this is a marathon, not a sprint. This isn't a solo performance. It takes practice, it takes patience, and it takes a whole lot of support. It really is a team sport. And you and your baby, you're the star players. And if you take away only one thing from our time together today, please let it be this. If this is hard for you right now, it is not your fault. Your body is not broken, and you are absolutely 100% not failing. You are learning a new skill, and with the right tools and support, you can and will figure this out. You've got this.